Health Secretary Steve Barclay couldn't contain his excitement this week, tweeting, "A newly qualified nurse will typically earn over £31,000 a year." It is, of course, complete bollocks from a health secretary who also thinks he can see 40 new invisible hospitals. A newly qualified nurse earns about £27,000 a year. And thanks to the Conservative government scrapping the nurses' bursary, which had previously reimbursed their tuition fees, they now qualify tens of thousands of pounds in debt. And sit down for this next bit. In a press statement on November 13th, the hapless health secretary wrote, "A newly qualified nurse will now typically earn over £31,000 a year, including overtime and unsocial hours payments." Including overtime and unsocial hours payments. So the Health Secretary's tweet was deliberately misleading. Our nurses deserve so much better than this. The simple fact of the matter is the government gave nurses a crappy real terms pay cut last year, it gave them a crappy real terms pay cut this year, it wants to give them a crappy real terms pay cut next year, and all that's on top of a decade of crappy real terms pay cuts. I guess if nothing else, at least they're consistent. Nurses are now using food banks and taking out payday loans to feed their families. Some experienced nurses have seen real terms wage cuts of as much as 20% since 2010. It means they're now effectively working a day a week for free. No wonder a third of the nursing workforce is considering leaving due to poor pay and working conditions. That's not good when we've already got a desperate shortage of 47,000 nurses. The Health Secretary thinks uncapping bonuses for millionaire bankers is a terrific idea, but all our nurses deserve is another crappy real terms pay cut. Well, absolute bollocks to that. And remember this, the dispute is not just about pay. Nursing staff have had enough of being taken for granted, enough of unsafe staffing levels, and enough of not being able to give their patients the care they deserve.
And I think most people watching will recognise that that's obviously unaffordable.
Just weeks ago, the Conservative government crashed the economy and blew a £30 billion black hole in the country's finances. That £30 billion would have covered a pay rise for nurses for years to come. Why should nurses and other workers now pay the price for the Conservative government's catastrophic mismanagement of the UK economy?